because closely linked to COVID-19 is how we also need to deal with diseases or ailments that come about because of the weather pattern. We're talking the raining season, and it is accompanied by certain ailments. But, well, the next phase of the segment is going to take us about how we can educate ourselves, become very much conversant with what diseases are there accompanying the period, and then what we can do. We do have joining us via Zoom infectious disease expert or specialist at the Kolibu Fevers Unit, and then the UGMC, the big place where we're keeping some of the topmost big men for COVID-19. But look, good morning to you, Dr. Isabella Ifasamwa.
Good morning.
How have you been doing yourself? It's a rainy season.
It's okay. A little busy with COVID activities, but fairly good.
Usually this time of the season, pre-COVID, what usually are the ailments or some of the diseases that we tend to record?
So it's been a cyclical pattern, as you said, seasonal, and most of the time with the rains or just after the rains with some flooding, we are seeing more of malaria, diarrheal diseases, and also a lot of the viral infections. Of course, now with COVID still ongoing.
So the symptoms of those ailments, are they, what are they usually? What are the predominant ones?
So by and large, they share about the same constitutional symptoms. So you may have fever, you may have you may easily be fatigued, you may have muscle pain, joint pains. So we'll call them myalgia, arthralgia. You may have headaches. So unfortunately, all these three may present with that. More so with malaria, and then the viral infections, which are usually the upper respiratory tract infections, the common cold. And now with the COVID as well, you may have overlapping COVID presentations that you may mistake it for malaria or the upper respiratory tract infection. And of course, the diarrheal disease, they are often presented as diarrhea plus or minus vomiting. And what is worrying is if it's goes on for quite a long time without prompt resuscitation, then you are going to have somebody becoming more lethargic and then go into a more severe case, which can lead to fatalities. Yeah.
And for you, the disease and health expert, when we have such seasons, do you send maybe treatment guidelines out, depending on how you have observed, or you just go the regular route?
So I know for sure that Ghana Health Service puts up an alert, especially regarding cholera. With the malaria control program, every district, every hospital has a way of surveillance, like monitoring what is going on. So as health professionals, there are those of us who are in the hospitals, which by way of practice, you have to add on when you are given medicines and all that, you add on the advice, that's the non-pharmacological therapies advice. But then Ghana Health Service also puts up notices, okay, especially on their website. Sometimes there are the adverts and all these flyers that move around just to help us alert us on what is happening.
I read the 2018 Ghana Health Service reports on prevalence of diseases, and they said malaria is recorded at a rate of 40% averagely at OPDs. Is that the case?
So usually that's the case, but again, sometimes data can be skewed if we also don't produce good data. So for a while now, Ghana Health Service has been telling us, like, we keep on preaching test and treat, okay? There are lots of diseases, again, as with COVID, that can present similarly like malaria, okay? So if you don't test, it's difficult to find out really whether it could be malaria that is causing it. Remember that influenza too is seasonal. About this time too, may have influenza, a lot of the flu virus. So a lot of people go through a whole lot of viral infection, and they might mistakenly, take it as malaria. But by and large, depending on how the results are churned out, if testing is done, yes, malaria continues to be the commonest disease, especially in these seasons, in the rainy season.
Now, as we transition and try to do the combination of thoughts in terms of what the annual ones will be, diarrhea, cholera, malaria, common cold, and now that we have COVID, how then do you advise that we go about from the domestic side or from the home if we feel that something is untoward in our body within this time?
So, thank you. So for me, the first thing to do regarding anybody's health is preventive measures, okay? We can never overemphasize on the helpfulness or the need for hand washing. By and large, most of these diseases come as a result of improper, healthy living, more related to sanitation, how we handle our foods, our environment, okay? So if we start with the basics, which is hand washing can go a long way to avert a lot of diseases that can be caused by even these diarrheal disease and then with viral diseases. When it comes to malaria, unfortunately, around us, we have things that are difficult to control now, but of course the government has to help. So we see a lot of puddles, formed as a result of the rainwater, Then we have a lot of containers around us, which will all collect water. And funny enough, people think that malaria is usually as a result of dirty water, choke gutters and all that. Yes, those choke gutters and dirty environments can also drive the diarrheal disease. But the mosquito, the Anopheles mosquitoes, it thrives. It breathes more in the clean water. So around us, if we are able to clean our surroundings, get rid of these car tires, bottles around, which will all collect water, we would, first of all, decrease the breeding rates of these mosquitoes, because it's these mosquitoes that are going to, as it were, grow the organisms, like the pathogens that are going to cause the plasmodium that is going to cause the malaria. So if you get rid of it, you don't even have the malaria in the first place. Then going back again to preventive measures, we have mosquito nets. Unfortunately, that drive, you hear about it for a while, then you don't hear about it again. It's as very important as it was in the past as it is now, okay? Mosquito net has been known to avert a lot of malarial disease and death, so as much as 30%, okay? So around that, if we can't do much regarding the control of the mosquitoes, if we have been able to sort out the containers, get rid of all of them, but of course, unfortunately, we have puddles that we can't do much about, trenches and all that, we can't do much about it. Sleeping in the mosquito net is also very helpful, especially around this time. And of course, with the COVID and all that, we should be alert for symptoms, fever, sore throats, chest pain, breathlessness, so that we report immediately. And the diarrheal disease, we should be more cautious about our food handling. As much as we can, we should cook more at home when we can, and then be mindful of our surroundings, keep the places where we handle our foods very clean, and use potable water when we can.
We are told that when it comes to COVID, there's a certain demographic in the population that are always covered. They have good immune system, the generalizations. If we bring that story home, those statistics, how can we relate that to what we're discussing now?
So I don't know if I would agree with you regarding immunity for COVID and all that you were saying. All I know is COVID is no respecter of persons. It's a new virus, okay? So we haven't had immunity as a community at all. What is said is that some people are more at risk of severe disease, okay? And they are the ones with the comorbidities. Otherwise, everybody is at risk of COVID, okay? So the whole concept of washing hands with soap and water, clean water, using a sanitizer, staying at home, social distancing is still very relevant here, okay? It is no respect of person. You can't say it belongs to a certain class of people. Yes, some class of people might have been engaged in some activities and might have been predisposed, they might have had the exposure. But for now, it's no respecter of persons. But people who will really get severe disease are those that we often talk about, those with comorbidities, hypertension, diabetes, obesity, elderly, and so forth. Yeah.
Many of us have children, and now children are home. But I see a certain pattern, and I live the life, so, and I'm sure you live it too, because you're a health professional. You're at the end or the beginning of the treatment phase. Because based on my experiences and relating to health professionals, all of you now have become frontline people. You're reporting the cases now in the centers. And where I work as a media person, I also do the interfacing. So I will say that my interaction with population is higher. Since we have a lot of children at home, and then we may have maybe family taking care of, elderly family taking care of them, or some category of people, and the children are home, what would you advise? Because we go out and we have to come in.
Okay, so let's take myself, for example. Thankfully, my mom is at home taking care of my children. I visit them during the weekends, okay? But again, I can't be immune to the virus. So usually everything still applies. Washing of the hands, personal hygiene also still applies. The children, I teach them how to also wash their hands and keep good hygiene. And for a while now, a lot of people have been taking supplements and all that. It's good. Eating healthily is good, okay? Taking vitamin C is good, okay? So if you are able to maintain those personal hygiene, we are able to wash our hands and all that, they are still protected. And then again, coming back to us, if you are leaving your workplace, it is still very important to clean your hands. If you can have, like for us, we have dresses we wear at work, okay? Then when we are coming back to the house, we change. Some people have the opportunity of even washing down at work, which is also good. But when you come home, try and keep your used clothes, at a safer place to be washed later, if you can. And then wash down immediately, so that at the end of the day, should you, of course, you were exposed, you decrease the risk of exposure to your children as well. And regarding you coming home, some people can't afford to stay away from their families because they have really nowhere to go. So those are the bits and pieces that I'll put in. We still should continue with cleaning of surfaces and all that, even though CDCs and WHO has come to say that it adds little to the transmission. But yes, it should still not prevent us from keeping ourselves clean. Even if it's not COVID, it will decrease transmission of other infections.
The related issues of how we are able to navigate this would mean that we have to keep ourselves safe. Now, there are children going to school at the basic level, pupils. We've been asked to categorize them per what they are. Now, since they live in the house, and leave that house to school and come back, how prone are they to such infections, either infections related to the season or to COVID?
So, sorry. Hello. So, regarding those who are moving to and fro from their homes to school, the same rule applies. Okay, have your face mask on and practice social distancing. And if you are aware, on the television and some other billboards, it's been there have been a lot of videos that the Ghana Health Service, Ghana Educational Service has churned out regarding what the children should do. I mean, with respect to such COVID. Yeah. So I think if they just comply with all that, and then in their movements, they also wear their face masks, they keep to the hand washing and all that, they would be fine. And remember, for now, the school distancing is still restricted. It's those who have gone, like those who have exit exams, who have been asked to go to school. So we are not going to have much overcrowding. And I believe there have been a lot of rules set out for the teachers in school as to what the children should do and what they shouldn't do. There's social distancing, how they should sit and all. If we comply with those things, there's a better likelihood that the children might be safer. Okay. But otherwise, if we just let everything loose, we go back to our former behavior patterns, that is when they are more at risk of getting COVID.
Covering elections, registration since Tuesday. And the pictures we've been showing or seeing and showing don't tell us a good story. I'm sure you have cited some, haven't you?
Yeah.
Okay, great.
Yes.
Now, these pictures, if you have the feed even on your Zoom there, are showing people not observing protocols, face masks wearing, distancing, etc. Where's in Accra? From the stables of somebody who is an infectious disease specialist and the discussion we're having, how can you interpret these things you're seeing?
So it's unfortunate with all that is happening. Sometimes I wonder if we still think COVID is a lie. I mean, from some of your interviews with people in their homes, a good number of people still believe that it's non-existent. And they have all these myths that they believe they won't get COVID. I mean, it's unfortunate to see what we saw. I mean, with the crowd restrictions of even 100 or so, we are still not complying. Where we have reached with COVID, okay, we need to take it up on a community-based level. Wherever the registrations are taking place, I believe there are district assemblymen, there are authorities in those areas that we can by ourselves protect, you know, rather than always look up to the government to step in. So if the MP of those areas or the whoever has authority in those districts can get to those places and enforce that there's hand washing, there's social distancing, that this number of people, strict number of people at a certain area at a particular time, like what was done at Richard, they marked some areas where people are supposed to sit, and they make sure that there isn't overcrowding by doing all that. Okay, I think for us Ghanaians, we wait so much, everything has to be government. But unfortunately, the disease is with us. So on a community level, I think this is what we should be doing. Authorities in each community is as important, the restrictions are as important to them as every politician. I mean, everybody in this community should ensure that these practices go on safely. And that can be done by also making sure that the behavioral patterns that have been prescribed are adhered to.
All right, so we have to announce the phone line 055 05566140049. We want you to join us. Our phone line is only one, not the 030. Please don't call that line. Call this line. We'll put it on the screen for you. 05566140049. Well, if you have questions and perhaps even physically you're not feeling well, or you just feel that, you know, that tinge of unwellness is within you, please, this is the time for you to call, get interactive, let us know what you think. And the number is 05566140049. Again, 05566140049. And let me just ask a question related to still the registration exercise. Now, while we say we want to wait for the authorities to do the enforcement and for us also to obey the protocols, after anybody, could be in any constituency, has visited any of those registration centers where these protocols have not been observed, what should we be doing after we come back to our reality or home?
Okay. So, I'm sorry, looking at your screen, I'm actually checking to see whether there's the Veronica buckets or any place that we can have hand washing. But as an individual, even if we don't have it there, unfortunately, we should have it there. I mean, but even if we don't have it there, I think we have the sanitizers. We should sanitize our hands there and then, okay? Then when we get home, we wash our hands. And of course, you shouldn't go there without your mask on. And having a mask on can be as ironical as putting it, as people will call it, having a chin mask. We should refrain from those things. Have it on to protect yourself, all the way from your nose to your chin. But when you get home, washing of hands, key. So when you get to wherever where the registration place, avoid the physical contact as much as you can with people and then with objects around.
In the UK, they practice this community type of health system. You go see a GP. And I've interacted with some Ghanaians who are GPs, and they say they don't treat COVID. So they have the protocols well laid out. If we want to maybe transpose that into our system, what would that be? You're in a community, you've gone through these registration centers, you're not feeling well. What would that be?
So in the first place, some community centers, hospitals, or health services have telemedicine. If you can afford, that's fine. At UGMC, they have an app called Lucy, okay? Lucy. So if you have, unfortunately, is marked for certain higher grades of smartphones. So if you can get on to Lucy, you can upload your complaints and you can get a doctor attending to you. If you get to, aside that, if you go home and then you have symptoms, okay, this is not the time that people who especially shop, do hospital shopping, that's not the time to just go and do checkup and all that, okay? Because a lot of our hospitals are choked with COVID patients and other cases that are really putting a strain on the hospitals. But of course, if you have the need to go to the hospital, if there's really a problem, don't still sit at home if you can't get onto this telemedicine, if you can't get onto the apps. If you could get onto that, that's the best, because you'll be monitored frequently, sometimes more than once a day. At least you'll get someone call you if the need be, okay? So if you can't do that, there are other hospitals. We have a lot of health posts and polyclinics around. You can visit one so that in case there's anything more serious or sinister, it can be solved quickly. Otherwise, again, the preventive measures just to protect yourself.
Again, the phone line is announced 05566140049. Let us know what you think. But what will be your advice as we wrap up this conversation?
So the message is still clear. Stay safe. Stay at home if you don't need to go anywhere. Put your face mask on, but most importantly, wash your hands as often as possible. You can't replace hand washing with any other thing. The alcohol hand rub is for you to use when you don't have water, clean water and soap available. If you use your alcohol hand rub about 4 to 5 times, try and wash your hands thereafter. Again, with respect to malaria and other diseases that come with rainfall, try and keep your environment clean. Do away with the puddles if you can. Fill the holes, the craters that from the puddles. Report places where you are having construction, that there are big trenches that people are refusing to deal with, so that those trenches can be filled. And keep your surroundings clean. Handle your food properly. If you can, cook as much as possible from the house. Eat hot food and try and exercise. Eat fruits washed very well, okay? If you get any diarrheal disease, think of rehydration as soon as possible. Get ORS, in your house. If you can't get it, you can make the ORS at home. Usually it's a simple one. Half teaspoon of some table salt, 6 teaspoons of sugar with 1 liter of water. If any diarrhea or vomiting start rehydration immediately, okay? Observe for children who are not active, who are not crying. If they cry, you don't even see any tears. Those are the things that you should take immediately to hospital. Otherwise, start rehydration with ORS as soon as possible. Supplement with coconut juice if you can, orange juice, bananas, so that, it doesn't get worse by the time you seek help.
Well, thank you very much, Dr. Isabella Ifuasamwa. I remember I read something on TB, as was published about, I believe, 2 years ago. Your name was also in there as one of the main contributors. So we'll see how it goes. It was guidelines for TB preventive therapy in Ghana. But for all the good work you're doing for the health service in Ghana, with all the sacrifices, I'll say that we wish you well, Ma'am.
Thank you very much.
Okay, Dr. Isabella Ifuasamwa, that was quite educated.
Yeah, absolutely. She's